Facebook and YouTube Live viewers. Naririto na naman po tayo sa ating Nutrition and Health webinar series. This is our 11th episode kung saan ang pag-uusapan natin ay tungkol sa mga sakit na madalas nating maranasan, bata man o matanda, maski sino nakakaranas ng ubo, sipon, at least once in their life. So ano ba talaga yung common codes na tinatawag? Ano ba ang pagkakaiba nito sa flu o trangkaso? That said, this afternoon we are privileged to have a doctor enlighten us all on the common codes in flu and how to tell the difference. This webinar series is a community service brought to you by Pharmacia Jimenez Corporation with today's sponsors, Cell Life Cellular Nutrition and Oranim Terra Mouthwash. I'm Grace. I'm going to be with you for the rest of the hour of this webinar. This afternoon, we are so blessed and privileged to have a doctor in the house. She graduated medicine in Our Lady of Fatima University School of Medicine, and she had her residency training in pediatrics in Rizal Medical Center in Pasig. Si Doctora also is a diplomat of the Philippine Pediatric Society, and she is actually currently a consultant where she has her practice alongside with her wonderful husband, Dr. Arnold, in their very own clinic, the Alvarez Medical Clinic sa De Castro Subdivision in Pasig. She is also a consultant in Mission Hospital, Holy Life, and Mother Regina Hospital. Aside from being a mother, a doctor, of course, and a wife, she is also a pastor of Jesus the Messiah Global Ministries. Let us all welcome. Good afternoon, Dr. Salome Amba Alvarez. Good afternoon, Dr. Alvarez.
Hello, good afternoon. Good afternoon, Grace. Good afternoon, everyone who's listening today. God bless us all. And I know we will learn many things about the common colds and flu and its difference and its preponderance and treatment. And alam ko, marami tayong gagawin for us to learn more this afternoon. Thank you for Pharmacia Jimenez invited me to be part of this webinar, and I know God has a purpose for this webinar. To God be the glory.
Thank you, Dr. Thank you, Doctor. Tapos at the same time, as we always do, we also invited a guest from the consumer side who will share to us her actual experience as a patient and as a guardian to her two teenage brothers. She actually has a degree in psychology and a guidance and counseling, and she's actually now employed from St. Scholastica's College, and she's currently working as HR and OD specialist at a private company also in Pasig City. Let us welcome, thank you for your time, Miss Alex C. Hi, Miss Alex.
Hi, hello. Good afternoon, everyone. Good afternoon, Dr. and Ma'am Grace.
Good afternoon. Say hi to everyone, your FB Live and YouTube viewers, Alex.
Hello, everyone, Facebook. It's my first time.
Thank you, Alex. Alright. Dahil napapanood tayo ngayon via Facebook Live sa ating mga Facebook Live at YouTube Live viewers, you can post your comments and questions below and we will try to answer them through our guest doctor. You can comment down below yung topics that you want to discuss on our next episode. If you find this episode meaningful, relevant to you, don't be shy. Give us a thumbs up or a heart. To our beloved viewers, you have a chance to actually win a special gift pack from our sponsors, Cell Life Cellular Nutrition and Oranim Terra Mouthwash. Kung mapipili po ang question nyo this afternoon. So don't be shy, magtanong po kayo at mag-comment po kayo. Let's start the discussion by asking Dr. Salome, ano po ba yung ginagawa natin? Ano po ba yung pagkakaiba ng pagkakaroon ng sipon, ubo at trangkaso? Paano po ba natin masasabi yung difference ng common colds from flu? At ano po ba yung pwede natin gawin para makaiwas sa ganitong kondisyon, lalo na po sa panahon ngayon wherein lahat tayo vulnerable. At ano po ba kaya ay yung mga home remedies kapag may sipon, may ubo, may trangkaso, at kailan po higit sa lahat yung pinaka-importante, kailan po ba talaga dapat pumunta sa doktor for our consultation? Dr. Salome.
Hello, good afternoon. I will discuss about facts of colds and flu. And these two different disease entities affected most the nose, the throat, and the respiratory tract. And colds is commonly seen in persons, and it is self-limiting actually. Medyo it is caused by mostly viruses, and rhinovirus is the most common cause amongst the viruses. And flu is also an infection to the respiratory tract, most same as common colds, same as colds, the respiratory tract is affected, but the difference between the two, mostly in flu, there's fever, and the difference between it is the fever, and it lasts for 3 to 4 days, yung lagnat, and talagang the severity compared to colds is greater. And colds, less fever, but some with very low immune system ay talagang makikita natin nilalagnatin sila. But mostly ay self-limiting lang ang colds. At talagang it is common during the rainy seasons kung saan talagang tumataas ang mga viruses kasi the changes of our environmental temperature. It's the respiratory tract affected, yung inflammation ng membranes, yung sa colds. At ito ay caused by the viruses. Inuulit ko, and the rhinovirus is the most common cause. And in my readings, actually, colds is the response, the symptoms that caused by the response of the body, the immune system response, the inflammation caused by the body normal response. I mean, kasi normally, ang body ng tao ay talagang we are given by God the immune system that will fight against the viruses and any foreign bodies that comes into our respiratory tract. Kaya nagkakaroon tayo ng colds. Amen. And it is transmitted via droplets. Kumbaga, pag umatsi ang isang tao o umawak sa ilong, umawak sa isang material, isang kamay o sa doorknob, pag nawakan ng isang tao din nakatabi, then it will be transmitted. And it is caused by droplets through coughing and sneezing. Kung yung mayroong sakit na makahawa sa katabi. Amen? Yeah. At ito nga ay most common during rainy seasons. At dito sa colds, meron tayong sore throat, runny nose, coughing, sneezing, headaches, body aches, na sumasakit ang ating katawan, pero hindi siya ganun ka-severe. Mostly yung talaga nasal ang presentation ng colds. And ang treatment nito, there is no medicine available to cure or shorten the duration of the common cold. However, may mga treatments tayo na symptomatic treatment. Sinasabi, kung ano yung naramdaman mo, kunyari masakit ang ulo, masakit, sobrang sneezing mo, you can take the cold medicine that is over the counter and many antihistamines over the counter. And especially, we need to rest. The 8-hour sleep na kailangan natin, we will need to talagang sleep. And increase the fluid intake. At yun nga, yung sinabi ko, kung masakit talaga yung ulo mo, pwede kang uminom ng paracetamol or any pain reliever that is available and over the counter. And also, yung gargle, warm, gargle with salt and water, at yung pag-dry ng ang nasal mucosa mo or yung mouth mo, you can use petroleum jelly and warm steam for decongestion and to boost the immunity. Actually, in my practice, when I have a patient with colds, I just ask them to have a nasal spray and oral spray, and I'm using one of the product of Permaseminase, which is the Oranim spray and the gargle. It is very effective. And in boosting the immune system, I'm also giving my patients with the cell life, the known algae, blue-green algae that was used years ago by soldiers using as their nutrition, yung para lumakas yung kanilang immune system, kaya i-boost. Kasi there's no treatment actually, but only boosting our immunity and resting, because we believe, because in their studies shows that by resting or sleeping 8 hours a day, the immune system will rebuild the inflammation in our body because we have natural immune system na binigay si Lord sa atin. So, and the other side of flu, what is flu? It is same as colds. It's a contagious respiratory illness that caused by influenza viruses. It can cause mild to severe illness. And in flu, there are serious outcomes because it can develop into pneumonia if not early detected, or if the person is weakened, even has a weakened immunity, it developed to the much deadly disease. And it's caused, I have told a while ago, that is because of the influenza viruses that infect our nose, causing us to cough, sneeze. We are distributing these droplets to our surrounding, affecting other people having the flu. Actually, many flu infections are very rampant in other countries, especially during the spring and fall season. The change in temperature in other countries, in Americas, in Europe, it causes many deaths because of this flu infection. The signs and symptoms same as in colds. However, the difference is it's greater intensity. The headache, there's a fever. In flu, the main event is there's 3 to 4 days fever compared to the colds, which is no fever or less low grade fever. But here in flu, it's a moderate to high grade fever, and there's also vomiting, diarrhea, and this vomiting and diarrhea is most common in children. There's also body aches, and very painful. Talagang ayaw mong bumangon, ayaw mong kumain kasi the throat is very sore. Kaya dito makita natin ang high-risk age for flu complications. The less than 5 years old, mostly the 2 years old and below, and the 6 months and below, wherein they are hospitalized because most of them develop pneumonia and other complications of flu. And in more than 65 years old, it is also common complications in pregnant and 2 weeks after delivery women, they're also prone to this flu infection, and also the other individuals with comorbidity like diabetes, cancers, and any diseases that depleted the immune system. And so in uh, in the treatment, actually one of the best treatment in this type of infection is prevention. Sabi nga, prevention than cure. Kanina nga sa common colds, we need to boost the immunity. In flu, to prevent severe complications of flu, we take time to get a flu vaccine. And every day, I think everyday preventive action to stop the spread of germs. Kaya face mask. Di lang sa COVID-19 tayo mag-face mask, kundi kahit pag mayroon tayong flu to prevent uh, to stop the spread of these germs or these viruses, we must use the face mask and take, if it's you cannot tolerate it, you can take an antiviral drugs. It is available in the market and it is prescribed and need prescription by a doctor. And the other one, the number very, very important in this flu infection is to boost immune system, because actually viruses can be fight by our own immune system if our immune system is strengthened by, sabi nga, by taking vitamins, minerals, by having our exercises, sunlight exposure, because the vitamin D is very important in our immune system. We take zinc, we take vitamin C, and also the spirulina that is being produced by Pharmacia Jimenez is very good immune boosting effect. The spirulina, which is the uh, I've known it years ago when I started my medical profession. I learned about the spirulina through Pharmacia Jimenez, that it is really good in boosting the immune system. Amen. And ito nga kanina na we will review the difference by this slide na ano natin slide, the difference between the two. Metabulation. Oh, yeah. You see the difference between the two, the onset of action and symptoms is gradual in the colds, where in the influenza it's abrupt, sudden change in body temperature, weakness, and body pains, and in fever is very rare. In colds, in influenza, it's usual lasts for 3 to 4 days, but the symptoms may last for 7 days. And the aches, as I said before, it is a slight in cold, and it's very usual and severe in influenza. And there is also chills, and influenza is chilliness in influenza, yung nanginginig ka, yung masyadong talagang nanginginig ka. It is common in influenza, but it's uncommon in colds. And fatigue and weakness, sometimes only seen in colds, but in influenza, it is usual. It is commonly seen in influenza infection. And in sneezing, it's common in the colds, and because it's a normal response of the body, the respiratory tracts uh, to stick out the nasal secretions to stick it out. So it is very common, and more on many patients think it is allergic reaction, but allergy is different from the cold caused by rhinovirus. And it is sneezing was sometimes seen in influenza, And the chest discomfort or cough is common in the influenza, and uh, sometimes it develops to pneumonia, severe one. And stuffy nose is common in colds, and stuffy nose, sore throat, and uh, are common in colds, but sometimes only in influenza. And headache is common in influenza. So uh, I reiterate, the treatment is over-the-counter cold medicine and over-the-counter antihistamine. Again, it's rest. So we take pain relievers, warm and salt water, gargling for sore throat, and as I said a while ago, say petroleum jelly and other moisturizing agent, so that the dryness of the skin, the around the nose and lips will be directed to. And I reiterate, in flu, we need the vaccination. Okay. And we need to consult a doctor when in common colds, when it's still persistent and you develop fever in common colds, you need to see a doctor. And in flu, you need to see a doctor after 3 to 5 days of fever persistent. You need to see a doctor because complications may develop. So I think you, every one of us learn about the difference between colds and flu. And sabi nga sa Philippians 4:8, whatever is true, whatever is honorable, whatever is just, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, dwell on these things. Amen. We just dwell in what is God-given beauty to us. Thank you for everyone.
Mhm. Thank you, Doktora. Salamat po dun sa inyong very brief presentation para mapakita sa amin at maintindihan namin kung anong difference ng common cold sa flu. Kung titignan ko pabalik yung mga minention nyo, no, mas serious yung condition ng flu. In fact, ang sabi nyo nga po, Doktora, pwede siyang mag-progress sa pneumonia. Unlike ng common colds, tama po ba, self-limiting siya. Ibig sabihin, after a while, kung magre-rest ka lang, support mo yung immune system mo. So pwede ka ulit, you will get well. Unlike ng flu, na nabanggit nyo nga, kailangan you have to see a doctor kasi 3 to 4 days kung hindi pa rin wala pa rin yung andun pa rin yung fever, hindi pa rin nag-improve yung pakiramdam nyo, you really have to see a doctor. So, Doktora, babalik ako sa inyo mamaya and thank you for sharing that with us. Pakinggan lang muna natin yung isi-share sa atin ni Alex. Although, Doktora, meron akong importante na remember dun sa minention nyo. Katulad ng sinasabi, the rest of our doctors previously, prevention is always better than cure. So, mamaya pag-uusapan natin yan, paano ba talaga mape-prevent natin. So, let's go to our guest muna from the consumer side. Miss Alex, yes, please share naman yung iyong personal experience sa pagiging ate mo dun sa dalawa mong teenager na brothers. Yes, Alex.
Yes, from my experience po kasi, good afternoon, Ma'am Grace. From my experience, usually, we don't get any colds or flu at all. So parang one day sipon lang or kaya one day cough, but hindi talaga yung super lala, like, unlike others na maulanan lang or maambunan. They get colds or flus agad. I think since during the pandemic, we've all been on edge and on our toes. Kunyari, kapag merong onti lang may bumahing, or kaya kapag merong nagsisneeze sa amin, sobrang edge namin. Kasi what will we do? Do we need to consult immediately since the start of pandemic? And so I think with the quarantine and everything, as well as the curfew, it's really been a bother to understand kung kailan na ba namin kailangan magpa-check up. Is this serious enough? Take medicine? Or will home remedies be a solution to what we're feeling?
So, tama ba ako, Miss Alex? Nag-agree ako doon. Dati, pag may lagnat ka, parang si mami lang yung na-alarm, diba? O, pwede na rin si daddy. Pero
Yes po.
buong kapitbahay, buong village nyo, diba? Natataranta kasi nilalagnat ka. I mean, kasi natatakot sila baka may COVID. But anyway, your question is, kay Doktora
Opo.
kailan ba dapat tumingin o pumunta sa doktor? Kasi you mentioned, diba? Normally,
yes
mo, hindi nyo naman kayo nakakaramdam talaga. Usually, 1 day, 2 days nawawala. But your question is really when to see a doctor. Doktora Salome. Doktora Salome. Yeah. Doktora, tanong po si Alex.
Hello?
Yes, Alex. Paulit natin. Iulit, Alex, kay Doktora yung tanong mo.
Yes, opo. So the question was if kailan po ba need magpatingin sa doctors if alam naming serious, especially on our side, hindi po kami nagkakasakit lagi. So is it indicative na kapag nag-sneeze na po kami or nagkaroon kami ng colds or flu, do we need to be checked agad sa doctor?
No, I said while ago, di ba sabi ko, when you develop the signs and symptoms of flu and you are feverish for more than 3 days, 3 to 5 days, you should consult a doctor because it cannot be a common cold. It could be a flu that will progress into a severe pneumonia or sepsis, especially when you are less than 5 years old or more than 65 years old. Ano? Okay.
Alex, paki-mention nga sa amin kung anong ages ba nitong mga brothers mo na inaalagaan sa house.
Yeah, both of them are teenagers naman na po. 15 and 14 respectively.
15 and 14. Yes, Miss Alex. So yun ang sagot ni Doktora. Kung halimbawa daw, hindi yung lagnat, tumatagal ng 3 to 5 days, she recommends that you see a doctor. Miss Alex, you mentioned also na hindi kayo masyadong nagtinatagalan ng sakit. Meron ba kayong mga best practices na ginagawa sa bahay para makaiwas sa common colds and flu? Kasi nakakainggit naman, wala kayong masyadong experience. Although now, as an ate, you take care of these two big brothers, at nagtatrabaho pa si Ate Alex. Ano ba yung best practices mo na ginagawa as an ate? Bakit hindi kayo masyado, and we're happy to hear that, na hindi kayo masyadong tinatamaan ng colds and flu.
Yes. Siguro po, our best practice is by drinking water. Na-mention din po ito kanina ni Dr. Alvarez na it's best to have your water intake as much as possible throughout the day. And I think iniiwasan rin namin siya by not using aircon that much. I think nasanay lang kami sa environment ng Pilipinas na kung saan may init and ganyan. Kasi we usually use and flu kapag malamig or nakastay kami sa isang place na air conditioned for a long.
So So tama ba Alex? Oo, yun yung best practices that you do in the house. Hindi kayo masyado nagpapa-aircon, lagi kayong umiinom ng water, tama ba? And I would suppose dahil mga bata pa yung mga
Yes
kasama mo,
po.
very active pa kayo, no? But I wonder during this time, quarantine kayo, pero ikaw nakalabas na. Kung ano yung mga physical activities, baka pwede mo i-share later. Entertainin lang natin. Thank you, Miss Alex, for sharing your secret to us. Baka meron ka pang tanong kay doktora aside from kailan ba makikita yung ang doctor for consultation.
Siguro one question po na I want to ask is, what if meron ka nung mga symptoms na regarding colds and flus, but your temperature is normal lang, like let's say 36.5 or 35.9. So do we need to take medicine na po agad with that?
No, because it's self-limiting. If you have only a temperature of 36.5, it's di ba? Sabi ko kanina, it's cool. It's only a common cold. So, if it's 36.5, no need to take any medicine. But if you're sneezing or the nasal discharge is bothering you, you can take antihistamine and decongestants over the counter naman yung lahat ng mga medicines and increase your immunity. Okay.
Thank you, Doktora.
Okay.
So,
Thank you po, Doktora.
sagot ni Doktora, pag yung fever, pag walang fever, pwede naman pwede tayong bumili ng mga gamot as antihistamine, yung mga anti-codes dyan na available naman. Meron tayong, thank you Miss Alex, thank you Doktora. May tanong lang tayo, Doktora, coming from our viewer. Sabi niya, Ellie, ang hirap basahin, Atup Salado. Tanong ko po, ganun din to, halos pareho ng tanong din ni Alex. Ano po talaga, mukha Doktora, mahirap i-decipher mahirap maintindihan kasi it's I think the same question with Alex. Sabi niya, tanong ko po, ano ba dapat gawin kapag tayo ay may sipon, ubo? Kasi sabi ng ibang doktor, ang sipon hindi agad iinuman ng gamot. Water lang daw po, tubig lang daw ng tubo, ganun din daw po sa ubo. Salamat po. So I think ganun din yung gustong tanongin ni Alex kanina, doktora. Kasi a lot of our viewers, nalilito sila kung pwede ba talagang inuman lang ng inuman ng tubig o talagang kailangan ng inuman ng gamot. Not necessarily may fever. Ano po ba talaga daw, doktora?
Diba? Sabi nga kanina, ang colds is 7 to 10 days. Umaabot sila ng 7 to 10 days. And if your immune system is strong, then it just mawawala lang din siya. At wala ka namang fever, just increase the fluid intakes. Sinabi ko kanina, di ba, yung colds is a normal response of our body kasi mayroon naman tayong immune system na develop na mayroon tayong immunity na yun yung parati yung sinasabi sa mga pasyente ko, yun yung sundalo na mayroon tayo sa katawan natin, and we allow that soldiers in our body, that immune system in our body to fight against the viruses, na eventually the inflammation will just subside kasi mayroon tayo mga anti-inflammatory cells sa body natin na mawawala lang din yun siya. Pero when it is persistent for more than, you are not febrile, but the signs and symptoms persisted more than 10 days, so I think you need to seek consult from a doctor. But when you have fever, it's different because when the fever is 3 to 5 days, you need to consult a doctor. Yun ang difference. Pag walang fever, 10 days, actually yung iba nga 14 days ng fever, ang colds, hindi sila nag-worry. Nakita nga natin yung mga bata, uhugin, 14 days na. Pero nawawala lang din kasi it is a normal response of our respiratory tract na talagang para ma-wash out ang virus na nakapasok sa ating throat. And siyempre, kailangan natin ng always clean yung environment natin para hindi mag-set in ang secondary bacterial infection na magiging cause nung magiging problema in the long run na karoon pa ng common colds. Ayan.
Doktora. Thank you po, Doktora. So, tama po ang pagkaintindi ko dun sa sinasabi ni Doktora. Pag sinabi po nating self-limiting, gagaling din siya kasi lumalaban yung ating immune system. Di ba po, Doktora? Unless meron tayong fever na tumatagal ng matagal, na binanggit din ni Doktora, kung matagal na masyado, more than 5 days na tayong nilalagnat, that's the time tayo dapat ma-alarm. Otherwise, kung sinisipon lang at inuubo lang na hindi naman nilalagnat, binanggit ni Doktora kanina, pahinga, strengthen the immune system, kasi merong tayong God-given strong immune system na lumalaban sa mga ganitong kondisyon. Tama po ba, Doktora?
Opo, tama. Yan ang kailangan na maintindihan natin. Dahil hindi nga, puro lang tayo gamot ng gamot. Hindi naman yun. Kasi nga, God is a perfect God. He made everything in our body perfect. As long as we take care of our body.
Agree ako. Yes, Doktora. As long as we sleep 8 hours a day, tapos we do physical activity, exercises. At yan si Alex, alam ko, very active yan eh. Meron din niyang bukod sa kanyang secret na ayaw niya pang i-share later. Miss Alex. Miss Alex, mag-share ka ulit mamaya. Yung next question natin, Doktora. Doc, bakit po ba ganon? Nagkakaroon po ako ng pagbabara sa ilong during summer rather than rainy season, from Miss Oris Nina Eda Domingo. Ayun po, mas meron daw siyang pagbabara ng ilong during summer rather than rainy season.
Kasi nga, pwedeng, it's not cold, it's an allergy. It's an allergy na common during the summer season. Kaya, it could be an allergy. Kaya, doon ka nagkakaroon ng bara sa ilong mo every summer time. Kasi maraming allergens at that time. May mga dust. Siyempre, pag summer, di ba, mainit. Maraming mga changes. Usually kasi pag mainit, nagdi-deplete din ng immune system mo. Kaya mostly sa'yo, sa tingin ko ay it's more on allergy.
More on allergy, Doktora. Summer daw siya din nagkakaroon ng pagbabara rather than, it could also be, no, Doktora? Kasi maraming kosang ang allergies, ano, pwedeng during summertime, yung mga pollen, ganyan, dust. Tama po ba, Doktora? Kaya nagkakaroon siya ng pagbabara pag summertime. Kasi naiintindihan ko dun sa, yung sister ko na pediatrician, sabi niya, pag summer, Grace, sarado niyo yung mga windows niyo kasi early in the morning, yung mga pollens daw lumabas. Hi to Doktora Nang po, she's watching. Doktora, may isa pa tayong question bago ako bumalik kay Miss Alex. Miss Alex, tatanungin kita mamaya kung ano pa yung, I'm sure si Miss Alex may isi-share siya na secret nilang magkakapatid kung bakit di sila nagkakasakit. Doktora, from Miss Malen Cruz, happy birthday to your husband, Dennis Cruz. Thank you, Ma'am Malen. Sabi po niya, Doktora, if you're dragging or feeling extreme fatigue, with colds and wala naman po kayong fever, is it likely a flu na po ba? So, extremely feeling of fatigue. Pero wala pong fever. Siguro, Doktora, yung sakit ng katawan, sobrang sakit ng katawan. Pero wala naman daw.
Sakit ng katawan. Kasi, di ba, sabi ko kanina sa flu, hindi naman siya lahat nagkakaroon talaga ng fever. Hindi 100% ng flu, nagkakaroon ka ng nagkakaroon ng fever. Kung, lalo na pag mayroon kang vaccination, talagang yung fever, kahit magkaroon ka ng flu, hindi ka basta-basta magkaroon ng fever. Kaya, most probably, when your body has extremely extreme pain, it could be a flu infection. Or how old are you? When you are old, it could be an arthritis.
How old? I think yung nagtanong sa atin si Ma'am Malen is very young at 45. Although kasi doktora, ang isang nakikita ko dyan na lagi kaya siguro may ganun siyang pakiramdam. She's also a very active mom. Anyway, doktora, thank you for answering that. Balikan ko lang po si Miss Alex. Miss Alex, ang tanong ko lang dito, no, we understand ang pagkakaintindi namin kay Doktora si Alex kasi takes care of her very active na dalawang kapatid. So during this time of quarantine, na nakikita natin, binanggit ni Doktora, yung nag-hatching ka, paano, tapos napapahawa ka sa mga bagay-bagay, dun mo na droplets, dun mo na nata-transfer yung dumi dun sa isang tao. Sa bahay niyo, Alex, aside from that, like now, nakaka-quarantine lang kayo, no? Tapos wala kayong masyadong physical activities. Tapos sabi mo, hindi kayo masyadong nagkakasakit. Pero dun sa mga oras na nagkaroon kayo ng one day codes, o sinipon yung mga kapatid mo, isang araw or two, hindi mo alam, on the first or the second day, hindi mo alam, how do you usually manage? Paano mo usually inaalagaan tong dalawang kapatid mo, Alex? Meron ba kayong something na tinitake or pag gano'n na feeling mo, naghihina ang katawan nyo o yung dalawang kapatid mo, Alex?
Usually po kasi what we do kapag meron silang sakit or anything na gano'n, since hindi po naman ako yung mother or yung parent figure nila, and ako lang po yung eldest sister nila, medyo nahihirapan po akong pasunurin sila sa akin most of the times. Pero syempre, I try my best na pilitin sila to take medicine or vitamins and take water as well as orange juice, mga ganyan. Sige, sasabihin ko na po, one of the vitamins that we use daily is Cell Life. Hindi naman po daily. Like whenever we feel that we are fatigued or meron kaming na-feel na we're not well or kaya merong masama yung pakiramdam namin, I tell them, sige, uminom na kayo ng Cell Life. That's what our mom tells us always and recommends to us. To always take Cell Life.
To always take Cell Life. So yun yung secret mo, Miss Alex, na tinago mo kanina pa. Hindi, joke lang. Thank you.
Yes po.
Thank you kay Mommy Janet sa pag-aalaga niya sa mga anak niya na may secret na finally ni-reveal na ni Miss Alex. Thank you, Miss Alex. So, Doktora, balik lang po tayo. We still have few minutes more, no? Meron lang pong nagtanong dito. Doktora, hindi po sa sa Facebook. Ito po. Pag po ba may lagnat at ubo? Paulit-ulit yung tanong. Sorry, Doktora, kasi magagalit sa atin yung live viewers mukhang hindi natin naiintindihan. Dahil po may COVID-19, lahat talaga, sabi ko nga kanina, binanggit ni Alex, ngayon pag naubo ka lang, nagtatakbuhan yung mga katabi mo. Dati nga sabi, pag nilalagnat ka, si mami lang ang abala. Si mami lang ang natataranta. Ngayon po, pag may lagnat yung isang tao sa kapitbahay, buong barangay na natataranta, nilalagnat yung isang kapitbahay. Kaya paulit-ulit yung tanong nila, Doktora, pag paumanhin niyo po. Because of COVID-19, sabi po niya, pag may lagnat at ubo, kailan po ba pupunta? Nakakatakot Doktora, sorry ha. Talagang kailangan sagutin natin.
Kasi nga, di ba, kung may lagnat at ubo, sabi ko nga, pag 3 to 5 days na yung lagnat,
Doktora, kasi natatakot sila sa COVID-19. So, ngayon, diba?
Kasi ang COVID-19, hindi naman yan basta-basta dadapo sa iyo. Kasi mostly, ang nadadapuan talaga niya, yung may mga comorbidity. At saka kung madapuan ka man, kung malakas ang immune system mo, hindi ka basta-basta madadapuan. Kasi actually dito sa clinic namin, may mga COVID-19 na may mga infection, pero hindi kami nahawaan. Bakit? Palakas ang aming immunity. Maliban pa sa, kaya nga ako, dati hindi ako natutulog, 4 na oras lang tulog ko, pero I see to it na talagang by 9 o'clock, matutulog na ako, gigising ako ng 4. Kasi, di ba sabi, sa pag-aaral na 10 p.m. to 3 a.m. ay talagang, yon, ang time na mas maganda na matulog ka. Kailangan matulog ka dun sa oras na yun dahil yung time ng rebuilding ng immune system mo para pagising mo kinabukasan, you can fight the viruses na mapasok sa katawan mo. At yun yung prevention, mga hand washing na pareho lang din naman ang COVID-19 at flu infection. Kailangan ang prevention ng hand washing and prevention yung mag-face mask ka para yung mga droplets ay hindi may lalabas. At yun nga, ang difference lang, may mga pag-aaral na sinabing may may airborne capacity ang COVID-19 na mga 8 hours lang naman yon, which is kung ikaw ay talagang maingat sa iyong sarili, kahit na magpunta ka sa clinic for check-up, ay hindi ka matatakot sa COVID-19. Bakit? Kasi yung katabi mo naman, basta 6 feet apart, ay hindi ka mahahawaan. Basta-basta ka. Face mask ka, naka-shield ka, huwag kang matakot. Kailangan basta pag may fever ka na 3 to 5 days, kailangan pa check up na ang iyong anak or ikaw mismo or kasama nyo sa bahay. Lalo na yung mga 65 years old and above at yung mga 5 years old and below. Kasi yun ang madaling madapuan sa mga.
Oo. Tama,
Yeah.
Doktora. Nag-agree ako dyan, Doktora. Yung sinabi mo nga, ang madaling mahawahan yung 5 years and below at saka 65 years old and above. Kaya talagang dapat wag silang palabasin ng bahay. Tama po ba, Doktora? So, thank you
Pero
for...
ito, Grace, maidudugtong na ako. Pero kahit na ikaw ay less than 65 and between 5 years old, kung hindi mo iniingatan ang sarili mo, kasi most of the time ngayon, marami nagpupuyat, di ba? Walang pasok, pero nagpupuyat. Matulog ng maraming tubig at talagang 8 to 10 glass full, kaya mo hanggang 11 glass full, inumin mo yan. Inom ka ng multivitamins, yung Cell Life. Yung apo ko nga, may apo kong dalawa dito na kasama namin sa clinic, tumatabi sa mga pasyente, hindi nagkakasakit. Kasi araw-araw ngumunguya ng isang Cell Life araw-araw. Yung apo ko na 3 years old and 1 year old, ngumunguya ng Cell Life araw-araw.
Oh, Doktora, salamat. I'm sure ikaw ang nag-reseta noon, kaya silang ngumunguya ng Cell Life. Maraming salamat po.
Kasi tagal ko nang matay na sa Cell Life.
Salamat, Doktora. May pahabol pa po tayo. Last question from Sol MGK. Doktora, we don't have Cell Life and Oranim here yet in Nueva Vizcaya. So Lana, hello sa mga taga Nueva Vizcaya. Ang layo niya. Meron sa Generica. Meron sa South Star. Wala pa ba dyan? Paging Miss Jessa ng PJC. Wala daw po sa Nueva Vizcaya. So Doktora, in the absence of, nabanggit nga ni Miss Alex kanina, nabanggit nyo rin kanina. Salamat po for mentioning. So paano daw po kung walang Cell Life and Oranim? At
Kung wala pa yung Cell Life and Oranim. Actually, meron nga akong pasyente sa La Union na lang dito pa nagpo-purchase ng Oranim na oral spray. At talagang kung wala kayong Cell Life at Oranim dyan, syempre, di ba yung mga salt and water at saka yung high mga B, zinc na mga vegetables na talagang fruits and vegetables, talagang mga vitamin C, talagang with zinc. Kailangan natin ng zinc at with vitamin D. Kailangan ng mag-expose tayo sa araw, exercise sa araw, talagang sa arawan. Kaya nga, di ba, medyo umitim na ako ngayon kasi medyo parati ako nagpapaaraw talaga. Kaya, yung kung ano nasa backyard nyo, yun ang gamitin nyo. Pero darating ang Cell Life dyan para mas madali nang nguyain. At more on at madaling lunukin. Kasi yung iba, yung mga bata, kahirap pakainin ng maraming gulay. Samantala ang isang ko 50 milligrams na tablet yun, okay na. Kaysa 200 ilang gram, 1 kilo na equivalent, di ba? Kaya mas maganda. Parating na yung Cell Life.
Para salamat. So ako, nagpapasalamat ako, Doktora, because you have your own personal experience to share dun sa mga nakikinig natin kung gaano kaganda yung experience nyo sa ating sa ating mga produkto, no? So kaya naimbitahan natin kayo rito para ma-share din 'yon. At we are so privileged na pinaunlakan nyo naman po kami. So far, Doktora, tapos yung ating 55 minutes. We only have 5 minutes, pero marami pa po sana tayong pwede pang itanong. But we're so limited with time. Pero Doktora, bago po tayo magpaalam, gusto ko lang po mag-agree din sa inyo kanina na sabi nyo, kung malakas ang immune system, hindi naman tayo dapat ganun talaga matakot sa kahit anong sakit, not just COVID. Kasi sabi nga natin, the biggest battle we face is not COVID, but fear. So we feed our faith and we starve our fear. Di ba po, Doktora? And of course, strengthen our immune system with Cell Life Cellular Nutrition and bantayan ang ating mga bibig ng Oranim. So, Doktora, it has been 55 minutes already, 5 minutes to an hour. Maraming salamat po. Before we go, pwede niyo po ba kaming bigyan ng inyong mga huling mensahe para po sa mga nakikinig sa atin ngayon?
Magandang hapon sa ating lahat. Ang huling mensahe ko sa lahat na nanonood sa Facebook at sa webinar na ito, ang kailangan palakasin natin ang ating pananampalataya. Kasi faith is very important this time of pandemic. Kahit na may sakit at karamdaman, kung nandun ang pananampalataya mo, you are seeing the things who are not as good they were. Pananampalataya mo sa Panginoon, pananampalataya mo sa Panginoong Jesus, na pumunta siya dito para ikaw ay magkaroon ng kaligtasan, parang sakit at karamdaman ay mapagaling. Kaya salamat sa Parmacia Jimenez, ginamit ng Panginoon para sa pinaka-importanting nutrition na makatulong sa cellular immunity ng isang tao ay produce nila. Kaya salamat sa Panginoon na ang opportunity na ito ay ibinigay sa akin. Kailangan palakasin natin yung faith, not fear. Kasi ang fear na ito, yun ang magpapahina sa immune system. Actually, yung fear and depression, nakakapagpahina sa immune system. When your faith increase, your immune system increase. Keep laughing. Tumawa ka. Kasi ang laughter is the best medicine. Kaya, maliban pa doon, nagpapabata. Kaya we just smile, laugh, and believe God is in our side. And God bless. Let the faith in you arise. Let Jesus be revealed in your life. God bless. Good afternoon, everyone.
Yeah, amen. I say amen to that. Wow. Oo, busog. Salamat po, Doktora. Again, I say amen to that. So, hindi si COVID dapat katakutan, Doktora? Kung tayo ay nananalangin at naniniwala. Salamat po, Doktora. That was such a delight for this afternoon. So, thank you for sharing your expertise to us, Doktora. And thank you, Lord. Thank you for sharing lahat ng experiences nyo. At sana sa uulitin, makaulit kami sa inyo. So, ganun din naman, Miss Alex. Miss Alex, of course, thank you to Mommy Janet and Daddy Chris for allowing si Miss Alex na mag-guest sa atin this afternoon. Miss Alex, would you like to say dun sa mga ate na nakikinig ngayon at nag-aalaga ng mga kapatid? Yeah, Miss Alex. Say anything.
Feeling ko wala po akong sasabihin except be patient. Especially if ayaw makinig, just be patient whenever they want to, kunyari yung sakit na nararamdaman, just be patient and tell them correctly and properly na we need to take vitamins and take care of our immune system.
Thank you, Miss Alex. Thank you. At sa Mommy Janet and Daddy Chris, thank you ulit. So, tapos na po yung another hour natin this afternoon. Next week po, ang topic po natin na pag-uusapan ay tungkol sa tamang timbang at gana sa pagkain ng mga bata o how to manage your children's weight and appetite during this time of quarantine. Mag-iimbita po tayo ng another expert dun sa subject matter na to kung saan po sa tatry niyang sagutin ang inyong mga katanungan. It's going to be another timely and interesting topic For our viewers, just visit and like our Facebook pages, Cell Life and RNE, Settle and Settle Active, IC, No Rush, Neem Clean Alcohol and Sanitizer, at of course our PJC Soap. Sa mga interested sa aming mga produkto, you can visit our website at www.farmaciajimenez.com. You can also buy our products sa mga leading drugstores, Southstar Drug, Generica, TGP, and of course, Mercury Drug Stores. At of course, sa ating mga authorized provincial distributors nationwide. So sabi nga ni Doktora, laughter is the best medicine. I can say, keep on smiling. It's the best clothes that you can wear this time of crisis. We will see you again next Saturday via FB Live and YouTube Live for another episode of our Nutrition and Health webinar series. Magandang hapon po sa inyong lahat. Thank you.